Do you frequently feel like your heart pains sometimes? Or maybe your ears suddenly turn red, swell up, and really hurt, even when you haven't been injured? What if your nose started to collapse slowly over time? Sounds scary, right? Well, these can be signs of a rare disease called relapsing polychondritis (RP). It's not common, but it's serious. RP attacks the cartilage in your body, the flexible parts in your ears, nose, joints, and even your windpipe and heart. Think of cartilage like the rubber tips on shoelaces. It protects and supports. When your immune system goes haywire and starts attacking this cartilage, it causes pain, swelling, and damage. This condition comes and goes in waves. That's why it's called relapsing. So if you've ever had sudden ear pain with no infection or worsening hearing with no reason, this could be a clue. What causes your body to attack its own cartilage? That's the key question. The honest answer is, doctors don't know the exact cause, but they have strong clues. Relapsing polychondritis is an autoimmune disease, meaning your immune system, which normally fights germs, mistakenly attacks your own tissues. Imagine your immune system as a security guard. Normally, it protects you from bad guys like viruses. But in RP, the guard gets confused and starts attacking the furniture, in this case, your cartilage. Scientists believe it might be triggered by a mix of genetics and environment. For example, maybe you have a family history of autoimmune diseases like lupus or rheumatoid arthritis, and then a viral infection sets it off. It's like the virus confuses your immune system, leading it to target cartilage. It's not contagious, you can't catch it from someone else, but it's your body's own malfunction. Let's play a quick game. Point to your ears. Now gently press the outer part, not the earlobe. Does it feel red, hot, and painful? That could be RP. The most common sign is painful, red, swollen ears, but only the cartilage part. The earlobe stays normal. Now pinch your nose, the firm upper part. If it starts hurting, collapsing, or gets soft over time, that's another red flag. Joints can ache too, like having arthritis. But the scary parts, when it hits your breathing tube, windpipe. Imagine suddenly feeling short of breath when walking or lying down, like your throat is tightening. That's because cartilage in the airway can weaken and collapse. Some people even have eye redness, hearing loss, or heart issues like a whooshing sound, heart murmur. Symptoms come in flares, bad for weeks, then calm down, then come back. It's like a storm that keeps returning. How do doctors figure out it's relapsing polychondritis? There's no single test. It's like solving a puzzle. They look at your symptoms, at least 3, especially ear, nose, or joint issues. Blood tests can show inflammation, like high CRP or ESR. Think of them as your body's alarm levels. But the key is ruling out other diseases, like infections or cancer. A biopsy, taking a tiny piece of ear cartilage, can help, but it's not always safe or needed. Doctors often diagnose based on pattern recognition, like a detective connecting clues. Treatment, it's all about calming your overactive immune system. Mild cases, steroids like prednisone, think of them as an emergency brake to stop inflammation. Bad or recurring cases, stronger medicines like methotrexate or rituximab, immune-quieting drugs. For airway problems, you might need breathing help or even a stent. The goal, prevent damage, reduce flares, and keep your cartilage strong. Can you stop RP before it starts? Sadly, no, because we don't know the exact trigger. But you can prevent flares and serious damage. Think of it like managing a volcano. You can't stop it from existing, but you can monitor and reduce eruptions. First, get early treatment if you notice odd ear or nose pain. Second, live a healthy lifestyle. Eat well, sleep enough, avoid smoking. It harms cartilage and lungs. Third, manage stress. Big stress can trigger immune flares. Ever get sick after a rough week? Same idea. Fourth, if you have another autoimmune disease, control it well. And most importantly, listen to your body. If something feels off, like ear pain for no reason, speak up. Prevention here means catching it early and acting fast to protect your body's support system. Good news, science is moving. Researchers are digging deeper into why the immune system attacks cartilage. One cool advance, biologic drugs like rituximab that target only the bad immune cells, like snipers instead of bombs. These are helping severe cases. Another study uses advanced imaging to see cartilage damage early, maybe before symptoms get bad. Think of it like an X-ray that shows weakness in your car's frame before it breaks. Also, scientists are checking if gut health, yes, your belly bacteria, affects autoimmune diseases. Maybe probiotics or diet changes could help. Not proven yet, but exciting. Clinical trials are ongoing, meaning real patients are testing new treatments. So while RP is rare, doctors are not ignoring it. Hope is growing, one study at a time.